The ideal candidates for the simple procedure have to be grown up already. This is a really key point because this is not a procedure for children like the NUS procedure is. The custom molded implant is hopefully going to live in the patient's body for a long, long time. So we want the patient's body to be at its mature stage so that we can hopefully make one implant and have the problem be over for the patient. The second issue that comes up is that the patient has to be healthy. Obviously, this is not an operation for patients who are having a lot of restriction of their lungs because of their chest or restriction of the heart function because of their chest. Those patients are not good candidates for this operation because this operation doesn't address that problem. And the third issue is that the patient has to be able to understand that with any operation, there is a 1 or 2% chance of complications and risks, and we take these things very seriously, and we take meticulous care to minimize these numbers. But the patient has to be around for us to take care of so that we can give them the best of our abilities in taking care of them. Before patients come into the office, we try to give them as much information as we can about not only the operation, but also about who is a good candidate and who is not. But the most important thing for a patient to understand is that we cannot practice medicine over the phone. We can't practice medicine on the internet. And so what we have to do is we have to give you as much information, educate you, make sure that you don't have one of the problems that would require you to have a more invasive procedure. But once the decision is made by a patient that they're really seriously looking into this procedure and would like to have the custom implant made, we would have to see the patient in person in our offices because that is a very hands-on visit where we make the actual custom mold of the implant. And as I always tell my team members, that is the most important part of the operation, even though it's before surgery itself, because the implant has to fit the body like a glove fits the hand.